Today is World Hepatitis Day, and over the past few weeks, 5 people have died in San Diego County as a result of a hepatitis outbreak. According to a report by the County Health Department, the outbreak is moving through the county's homeless population. In addition to the 4 people who have died, 5 people have died, 120 have been hospitalized. Doctors say anyone who has come in close contact with a potentially sick person should get vaccinated. The source of this outbreak has not yet been identified, but we have a lot of different things to talk about here. So let's talk to 2 people who know a little bit about this, Dr. Rohit Lumba from UCSD and Scott Suko from the American Liver Foundation. Welcome to you both.
Thank you.
All right, doctor, let's quickly talk about where you would contract hepatitis A. I know as a surfer that the ocean is a place that you can contract hepatitis A. Why?
Well, hepatitis A is a virus, and it can infect the liver and cause acute liver disease. There's no chronicity, and usually you get it from contaminated water sources or contaminated food. And then if a person is infected, it's basically could be transmitted if you come in close contact with that person and don't wash hands and they don't have personal hygiene. So that's why whenever you have such an outbreak, you're worried about individuals who may be at high risk. And particularly in San Diego, this outbreak started in November 2016, and we thought we will contain it, but it's actually continuing, and you don't really see people dying from this.
I was going to say, it's not necessarily fatal, right?
No, no. And here we've already had 5 cases of deaths, and I've actually personally taken care of some of those patients. And there is no treatment once patients develop acute liver failure. So it could be very difficult to manage those patients, particularly if they are homeless and don't have social support, that they could get something such as liver transplantation if they are dying from acute liver failure.
How does a vaccination help?
Vaccination is very, very good for acute hepatitis A. It has almost closer to 100% efficacy once you get it. Even if you think you got exposed to hepatitis A today, you can get the vaccine today and you'll be protected because there's an incubation period of about 2 to 4 to 6 weeks for hepatitis A. So you got exposed today. If you think you were taking care of somebody who has hepatitis A, you can get vaccinated today.
And so what's the point of, Scott, of this American Hepatitis A Awareness Day?
Right, so World Hepatitis Awareness Day.
It's World Hepatitis Day.
It is world. It's actually one of 4 disease-specific days designated by the World Health Organization. So it's a big deal on a global scene. For San Diego, we're focusing on hepatitis A due to the outbreak. And as Dr. Lumba said, talking to your doctor about vaccinations, we've got a number of resources locally through vaccination clinics set up by the county that you can find out about by calling 211. Also, CVS Pharmacy, you can go in there and get a vaccination, and some of their pharmacies have minute clinics where you do not need an appointment. Or, of course, talk to your doctor and ask if you've been vaccinated, and they can check if it's not part of your medical record. There's an immunization record for Californians, and they can check and see if you've actually received the vaccination.
What can you do? What are the tips that your organization is suggesting people do?
Well, on our website, there's a hepatitis A fact sheet, as well as the CDC's website and the county's website. And as Dr. Lumba was talking about, really good hygiene. Washing your hands is the #1 best way to prevent it prior to eating, and after you're out and about, just taking care of good hygiene.
Now, we vaccinate children who are 1 year or older, but people in our age group may not have been vaccinated. So this is a good idea now to get vaccinated if you work in a church or faith-based institution, if you're coming in close contact with individuals who may have hepatitis A.
So if you're volunteering, like at a homeless place, you might have come in contact with it without even realizing it.
I would totally recommend that they get vaccinated today.
So give me some tips on what things, washing your hands, what else?
The key things would be very simple. If you wash your hands before you eat food, if you drink water from hygienic places, and if you come in contact with somebody, try that you are already vaccinated or protected.
And what are some of the symptoms? So if people are afraid that they might have something?
Usually there's an incubation period of 2 to 4 to 6 weeks, so patients may not know.
Wow.
Once they develop symptoms, it's usually fatigue, nausea, sometimes vomiting, abdominal pain. They can develop jaundice, which is yellowish color of the skin and the eyes. And once you have that, you definitely need to see a physician at that time and be tested.
Dr. Luma Skatsuko, thanks so much for being here with us this morning.
Thank you.
On this World Hepatitis A Awareness Day. Thanks so much.
Thank you.